we've also started now working with doctors. I was just telling Mansa this, that, they are coming to us. Initially, that was the biggest problem, right? It was like maybe some doctors were like, "Nahin, online is not real." But now there are doctors who are coming to us and want to work with us because they see the benefit that patients get, which is adherence. The most important thing that everyone cares about is outcomes, right?
Yes.
And outcomes only improve through adherence. And adherence, a very important aspect of adherence is accessibility and affordability, right? Accessibility is not just, hey, I'm giving it to you at home, but sometimes people are just, a medicine or a therapy is out of access because of the price itself. And so that's why we don't even go into accessibility, affordability. For me, it is everything is accessibility, right? It could be because of the location you're in, because of your financial, socio-economic status,
Right.
All of these things contribute to the lack of access of these medicines, and that's what we're trying to solve for.
Hello and welcome to the HT Brand Leadership Series, a series of one-on-one interactions with top brand and marketing leaders who share their industry insights and strategies that have helped shape their stories. Joining us today is Devashish Singh, co-founder of MrMed, India's largest online pharmacy for super specialty medicines. MrMed is built on a patient-first, technology-enabled vision, going beyond transactional healthcare to support patients through access, affordability, and adherence in long-term treatment journeys. Backed by leadership with decades of pharmaceutical experience, alongside top-tier consulting and engineering talent, MrMed operates at a unique intersection of healthcare expertise, technology, and trust. In today's conversation, we'll explore how this foundation shapes MrMed's approach to marketing, brand building, and responsible growth in healthcare. Welcome to the show, Devashish.
Hi, thank you. Happy to be here.
Tell me one thing, do your friends and close network keep asking you for medical advice?
Yeah, I mean, since I've started this, I have become the house pharmacist. ये मैं ले लूंगा तो ठीक हो जाएगा.
Right, and how much proportion, how many doses, all of those intricate questions?
Everything. But of course, my standard answer is please consult your doctor.
Absolutely.
Because that's how it should be.
Yes.
Although not too many people, sometimes it becomes one of those, some pharmacies do enable self-prescription.
Right.
But I don't think that's the way forward. You have to ensure that there's a doctor that. But on a funny note, yes.
Yes.
I do.
Casual conversations.
Yeah.
So you've always been a techie, and you spent early days at Duke, and but you're a local boy from Bengaluru. How did pharma fit in your scheme of things? How did it all start?
So it started with my co-founder Saurabh. His family has always been in pharma. They were one of the largest distributors of general pharma at the time in Tamil Nadu, having also an international presence actually. Also, some of our earlier mentors were one of the largest super specialty distributors in the country. So we got to meet a lot of people during COVID. Saurabh was a good friend who I met in the US. And then we came up with this problem statement, and then I said it's something worth putting our energies into.
Right.
And here we are. Still a long way to go, but reasonably doing well.
Understood. You mentioned COVID, and COVID actually created a lot of behavioral change among users and consumers. Specifically, online became a larger conversation for many industries, and digital transformation was the hot word. Right now, it's AI. But tell me one thing: this problem statement that you spoke about, which is affordable medical care, in a country like India, it is a large proposition. There is clearly a gap that is visible. So do you see MrMed being able to provide and fill in that gap, because a lot of players are trying to do that?
Yeah. So actually, during COVID, right, what we realized was, especially in the first wave, like you said, there was digital transformation happening. A lot of e-pharmacies were exploding at the time. Some got sold to large giants even during COVID. But what we saw was the sale of super specialty medicines, so special medicines for cancer patients, kidney patients, patients on dialysis, etc., actually fell down.
Right.
And the reason for that was access.
Correct.
Either people stopped going to the hospital out of no choice, that there wasn't road, rails, airways to these larger cities, or out of they were just scared, right? There was if I go to a hospital, I'm going to get COVID. I'm already immunocompromised, and therefore there's a big chance of me getting COVID, and therefore having a big
complications.
Yeah, so that's when we realized that this problem is huge from an accessibility perspective.
Right.
So, which I think overall healthcare in India can be more accessible. And the more we dug into it, that's when we realized that there is a affordability problem as well.
Right.
Some of these medicines can be offered at 85-90% discounts. In fact, during COVID itself, in fact, the second wave, there was this one medication. The second wave was the worst wave, by the way.
Yes.
The Delta wave. There was this remdesivir medication. I'm sure all of us, remember this. So it was sort of like this liquid gold. You take this and you'll survive COVID. People were selling it for above MRP, like jacking up the price. We actually sold it at a 50% discount. We had only about 150 vials. We took patient information, their Aadhaar cards, their prescriptions, sold it without borders. Certain cases, we even sent it out in flights. We sent individuals in planes. So some of the top CEOs of Gurgaon actually approached us, and we sent it for their parents. At a time when people were fighting for these medicines, hospitals were fighting amongst each other, state governments were fighting amongst each other.
Oxygen cylinders are a problem.
Yeah, and actually, finally, my father-in-law, he was doing an oxygen langar at the time. So it felt very like, this is what I'm meant to do, right? Like, he was doing this oxygen langar. We're trying to get these medicines across the country to people who really need them. Of course, we did not succeed, because a lot of people passed away unfairly because of lack of oxygen or lack of medicines. But that's when we realized we saw the worst of healthcare in that 2 months, April, May, June, 3 months of 2021. And that's just exactly when we launched. So it was about accessibility at the time. Now you can see maybe it's not a big accessibility problem. There's no pandemic going on, but that's only in the cities. The accessibility problem is still there in your smaller towns. It's still there in the villages, right? They still have to come. So the problem that you're seeing right now, what we saw during COVID, actually exists every day for certain families. And that's what we're trying to solve, right? We all felt that problem during COVID. We're like, this is such a horrible thing.
Yes.
But that's what a lot of families today are going through. Overcharging, traveling long distances. Then that's what we try to solve.
Counterfeits also.
Yeah, I mean, so I think counterfeits is not a huge problem. I mean, of course, there have been certain, cases of this, but as long as, the supply is good and you're working with trustworthy people, you can still, it's just scum. Honestly, I'm sorry to say it. There's only scum of the earth who would enter into this counterfeit business.
Because there were stories.
I mean, there was recently in New Delhi as well that, there some cancer meds were counterfeited, and there was a huge bust that happened, and that's the scum, right? But those are not real, like that. Those are basically criminals.
Yes.
But moving beyond that, there are real challenges of affordability, and I think we're doing our part to make it accessible, affordable across the country. So still a long way to go.
Devashish, you were saying that your market is actually the individual or the patients who have critical or chronic conditions, but that's also part of super specialty therapies, and that's the USP. But then trust also outweighs visibility over here. How do you see that influencing your early marketing choices? Because if you look at the government, it also has a similar model, but it's for generic medicines. When we look at the model like Jan Aushadhi, from quality generic medicines at affordable prices to quality complex medicines at affordable prices. That would be your narrative over here?
No. So I think what Jan Aushadhi does is they, and which is a great thing that they're doing, and there are generic pharmacies, not just the government, there are others as well.
Right.
They almost recommend a substitute.
Right.
So there is a branded generic in India, for
Correct.
example. There is a paracetamol that we all take, a 650 mg paracetamol that
That's
we
right.
all know about,
Yes.
right? But then there are the substitutes for
Yes.
that, which is what a Jana Aushadhi provides. In that way, what it does is it almost takes the onus of treatment on itself.
Right.
So the pharmacy becomes the main
Enabler.
of the therapy.
Correct.
What we do is we provide the same medicine, whatever the doctor writes, the branded generic.
That is the medicine.
That's the one that we provide. So we do not substitute.
Correct.
We have the lists of all the medicine, like those all possible substitutes, and you can substitute if the doctor has written the generic name. But we do not, try to sway a patient from one therapy to the other, which, to be honest, is very difficult also in the super specialty category. When you are battling a headache or even, early onset diabetes, you can still, try to,
Deviate from the
go to the the generic version or the one that is not been marketed by two doctors.
Right.
But once you're in such critical conditions, I would say critical conditions, but definitely more serious conditions, you need to have, you probably pretty much blindly trust the doctor, and I think it is also important.
Yes.
Till India becomes at the level where, we almost are CDCSO, the FDA equivalent of India, of the UST in India. Once till we have that much trust that yes, whatever they certify is amazing, right? It can be sent to the US even,
Right.
Till that happens, those quality standards are met. Then I think till that trust is built, we would, continue to see branded generics play an important role.
Devashish, it's very interesting that you said that you treat patients, or your end consumer is who is battling a chronic condition or critical condition. But the early influence, how does that have an early influence on your marketing choices? Because even the government has a similar strategy where they're looking at quality generic medicines at affordable prices. In your case, there'll be quality complex medicine, which is prescription-based medicines at affordable prices. The key word here is making it affordable.
Yeah. No, from that perspective, of course, affordability is an important pillar of what we do. We provide, but I would say, like, beyond affordability, it's also accessibility, and I think it's trust more than all of these two things, right? It's that trust that we strive to build every day and maintain, right? Not just build the trust, but maintain that is very important. So yes, definitely people, like, it is a very big deal when you're able to get medicines which are, for example, 28,000 rupees, the most widely prescribed prostate cancer drug, and we are selling that for 6,000 rupees while still making money, right? So that's a huge difference of 22,000 per month. That's a per month cycle.
And there's a magic sauce there on how do you manage how do you?
I mean, it's just like I said earlier, I think to it's people in your team as well. It's just cutting out middlemen, playing no price games. Right. It's the same price regardless of whether you're in Mumbai or in Patna, right? Whether you drive a BMW or a Chetak, for us, there is no difference. Unfortunately, sometimes in the super specialty category, there are price games that are played. It's similar to like a lot of other products that you would say. For example, even mattresses. Everyone is at 50% discount all the time, right? So we don't play any price games and we reduce those things. So that's how we bring that affordability aspect. But going beyond that, I think it's that accessibility, that ability to ensure that we continuously meet and exceed patient expectations on a daily, monthly basis. That's how they keep coming back to us.
Right. So basically, it's a more advanced mode of Jan Aushadhi, if we can say so. How do you see your past experience in say consulting and engineering and other aspects, and making certain business decisions or marketing decisions to engage in this specific pharma space that you built?
So I think what I've been as an individual has always been a little bit logical. I think what also has helped is project management, just organizing. I think that's the only thing. When you organize yourself, you're able to. I think those things go beyond just work. I think it extends to everything, including packing your bag before going to a early morning flight. I think those are the basic things that you picked up, whether it is in school, college, working in consulting, staying organized. Not just in your life, but organizing tasks as well, right? Breaking down complex problems into actionable items. I think that's what has helped. Even in technology, I think what's helped is being logical. So these two things, being logical and breaking down things.
I say this because tech will play a larger role because you're trying to reach the hinterlands of India. You want to go and touch the corners which are so difficult to access, and I think tech will play its role. I think the most important part over here is how do you make them know that something of this nature, something of this price indexing is available to them, where medicines are actually affordable. I think that's the next roll of dice that we have that you will play now.
Yeah, I think like it is a marketing challenge, right? It is an awareness challenge, and we do struggle with it. I'm not saying that we're perfect with it, right? We don't have unlimited budgets. We don't do IPL ads, right? But yeah, we've to some extent cracked the code. We know where our target audience is around, right? We've also started now working with doctors. I was just telling Malsa this, that they are coming to us. Initially, that was the biggest problem, right? Which was like maybe some doctors were like, "Nay, online is not real." But now there are doctors who are coming to us and want to work with us because they see the benefit that patients get, which is adherence. The most important thing that everyone cares about is outcomes, right?
Yes.
And outcomes only improve through adherence. And adherence, a very important aspect of adherence is accessibility and affordability, right? Accessibility is not just, hey, I'm giving it to you at home, but sometimes people are just, a medicine or a therapy is out of access because of the price itself. And so that's why we don't even go into accessibility, affordability. For me, it is everything is accessibility, right? It could be because of the location you're in, because of your financial, socio-economic status,
Right.
All of these things contribute to the lack of access of these medicines, and that's what we're trying to solve for. And thankfully, a lot of a lot of people have given us their blessings early on.
If you have to wear the patient's shoes and look at the choices he or she has, how does the end user navigate a complex journey where he or she is trying to find these medicines at affordable prices, or probably looking at substitutes because the affordability is so high, is far off? Where does marketing play its role, where it shifts from persuasion to enabling? How do you see that narrative being constructed?
Yeah, so firstly, I wouldn't even say it's a patient who goes through this, right? I think it's the entire family. Right? For these conditions, especially the caregiver.
Yes.
There's a lot of information. Sometimes there's overload of information, or there's like dearth of information. And both of these things causes confusion. So that's what we try to do first, which is to clarify things. Right? If you're enabling information, there's a lot of times when you're going through this condition, even what the doctor's saying, it kind of goes over your head. And then you don't have the option to again reschedule an appointment which you're going to get after a few days, right? So this is where we are, I think, providing that information and doing so with empathy. I think that's important, right?
Exactly.
And when you're able to do that with empathy, authority, and actually empowering the patient, right? And we have that authority. We have, like we said, we are also inventory led. So we actually sometimes when the patient says, "Hey, listen, send me a photograph of the medicine you're going to send me," we do that.
Yeah.
Because some of these things go into lakhs.
Correct.
So that's where when we build that trust is, I think, a combination of that empathy, information, authority, and then obviously our sourcing is authentic, right? So this combination of these four things builds that trust, and that goes beyond any marketing slogan, right? Once you have that trust, it's organic.
Absolutely. So you spoke about trust. How do you see technology enhancing that quotient on trust and transparency rather than creating a distance in when it comes to healthcare interaction? Because when you look at some of the common players who are selling generic medication, everybody's trying to do a WebMD. They're all trying to tell you the symptoms and what the treatments a specific drug can have.
Yeah.
So here, how are you seeing technology probably addressing this
So
when it comes to trust?
yeah, I think that's a good one, right? And I think again, when we are all building these tech products, giving them information again is the most important. And information does not mean just, hey, these are the side effects, etc. Right? Making that information like understandable is important, and going beyond that, information about like for example, in cancer medicines, there are patient assistance programs that are offered. There are, and I don't want to get into the depths of them. There are also like, when are we going to dispatch this, right? There's dispatch the medicine, right?
Got it. When can I get in my hand?
Yeah, like we're also like enabling now visibility into the temperature in which your medicine was packed, the temperature in which you're getting it. Especially for a lot of these medicines are cold, temperature sensitive.
Yes.
You have to be maintained at 2 to 7 degrees, 2 to 8 degrees. So we're giving them complete. I think when you give complete information, not only about the medicines but also about storage conditions, how it's packed, when it's getting dispatched. So for today, for example, we don't dispatch any temperature sensitive medications on such Saturdays, because
Because of time lag.
like sometimes courier companies, we should send this all through like express shipping, through the air, right? It's all air couriers and air delivery. But sometimes there is, to just stop that small chance of a last mile error.
Right.
When we tell people, hey, listen, you've placed this order on Friday, sorry, we're not going to Friday night, we're not going to dispatch on Saturday, we're going to do it on Monday. Is that okay with you?
Okay.
And I think you should give in that kind of information, right? And that's all enabled through technology. That's all obviously algorithms that we've built.
Sure.
We are using AI now a lot more. And then, that I think builds that trust. Even the UI to some extent, right? There are certain things which are very, WebMD-ish. And then there are, sites which build that trust in you. So everything, I think, can build trust, and that's what we aim to do, because that's who we are, right? How we communicate, how can we bring that flavor not only into marketing messaging but also to front-facing technology.
And that also helps you build a relationship with your consumer, because you're giving them the right information at the right time, and also telling them in full transparency when they will get the medicine in their hand.
Yeah.
So that's part of trust building, because these are again super specialty medicines. If I have to further probe on the credibility piece, the patient engagement is not about just making that purchase and letting them know this is where the medicine comes to them and medicine comes to them, because there will be another order coming from them.
Yeah.
How do you sustain engagement with this community? Because at the end of the day, this is also a community for you, and you need to service it, keep on servicing it as time goes along.
Yeah, and you hit the right word, right? Community. It is a community. We are working to build that community to make sure that people talk to each other, because there are a lot of them are going through the same problem, right? If you want to engage people who are going through similar problems, that you need to talk about those problems. And I think that's what we're working on, along with some of the people who have gone through this. How do they help people who are getting into this, engaging beyond that transaction, talking to the caregiver.
Yes.
I think that's very important. Asking them, like, how are you doing? Is it? It's not just, hey, now it's time to order medicines, go ahead and refill. But how are you doing, right? Is there anything else? There are certain things that you were supposed to get, to take care of your parent. Are you okay with that? And we're building more and more on this. I don't think we're even close to what I envision we should be, but it's taking some time, and we'll get there.
Understood. So, what I would like to further ask you, or rather what we want to understand further, is that it's all about credibility end of the day, because once you have an engaging conversation and you win the trust of the consumer, it's also about sustaining, and that's how you build credibility. At the end, you build a brand that everybody wants to be loyal to. There is also this risk where misinformation spreads very easily, because we live in a world of WhatsApp and everybody has a point of view on cancer, on diabetes, on various diagnoses that need to take place. How do you balance simplicity with medical information, or medical accuracy rather?
So one thing that which we'll never do is have the wrong authority give the wrong information.
Right.
I'm not going to sit and talk to you about weight loss.
Right.
Whether these GLP-1s are useful or not, should you take it, should you not, should the celebrity have taken it or not, right? I'm not going to talk about that. But will we get an endocrinologist who's working with us talk about it? Of course.
Yeah.
So I think that's the most important thing, right? If the people who are empowered to talk about a certain topic, then I can talk to you, for days about technology, about marketing, about even building, scaling, etc. But I'm not going to talk to you about medical information. Similarly, our pharmacists, they know about, so they're all pharmacists, right? They've all got their doctor of pharmacy or bachelor of pharmacy degrees, and so they know
Right.
the side effects. They can explain those aspects, right? But they're not going to again prescribe medicines, and I think that's where we stop, right? We don't want to prescribe medicines, right? We can enable you to find a doctor who can prescribe medicines to you, who can help you, but we are not going to skip or cut corners to just enable a sale or enable some sort of a purchase.
Understood. Because there's so much of fear-based narratives or very exaggerated narratives on how you should be looking at a complex disease, like whether it's a cancer or it's a chronic disease. There's so many exaggerated narratives. How do you build credibility over there? You continue having the right conversations, getting the right doctor fraternity to comment on something, or do you rely on your internal sources or your internal resources that you build?
I think we rely on our patients because they are our advocates, right? There's nothing beyond that, right? Today, even if you see how our any great healthcare institution built,
Right.
it's through that organic referral, right? You can go out and shout. Of course, we do that as well. We do marketing, targeted marketing, but I think the biggest advocate is our patients, and they talk a lot more.
Fair enough. Let's touch upon scaling now. If we have to look at scaling this model in the next 3 to 5 or 7 years, how do you continue to keep the patient in the center and look at your operations so that it remains consistent? Because at the end of the day, the patient is also getting used to you, building a habit of ordering from you, and knows that this is how the communication will happen. So is there a certain roadmap that you've defined now?
Yeah, so I think what we are fairly confident and clear about is we want to stay in this underserved super specialty segment.
Right.
And within this segment, we want to add more than just medicines.
Got it.
So what does this mean? This could mean adding counseling services for the caregiver.
Right.
And you'd be surprised. It's not just counseling, which is the mental wellness, which is very important, but also questions like, hey, what do I do? When my parents coming back from the hospital, do I need to create a separate sort of a room? Do I need to put AC in that room? Right? So should I remove AC? Is AC good or bad? You tell me. After a patient comes from the hospital, is AC good or bad? And the answer is, it depends, right? Yeah, it just depends, right? It depends on what is more important is cleanliness. Yes. What is more important is the room is, ventilated. Yeah. So these are more important things, but the questions are, so many questions, right? Do I keep them in that bubble like how we had during COVID, right? Which is sanitize everything, and these are real questions because people are immunocompromised.
Yeah.
So whether it is giving them that information or actually getting a nurse to come home and help them administer certain therapies, we're working to build that entire full stack We're not going to do everything on day one, but slowly, that's where we want.
If you have to look at an inside out approach, is internal culture very essential, driven by ownership and flexibility, or right now the focus is all about an outside in kind of a brand trust building model?
I think it has to be parallel, right? You cannot, I cannot tell people that, hey, so this is what we spoke about in our last, town hall meeting.
Yeah.
That we, our patients are like our grandparents, our parents. And I cannot just tell them, like our team members, to think that, right? They need to feel that.
Yeah.
And that is part of the culture, right? It's of building culture, where we enable people, which more than flexibility, I think it's enabling people to make decisions. Right? If there is something that is like, how would you decide if it was for your parent? What would you do?
Yeah.
And I think when you just keep that in mind, the decision making, whether it is a delivery boy or it is a pharmacist, that decision making becomes very easy. So I think it's a little bit of both. It has to be.
That's very well put, actually.
Yeah.
If I want to just stay on this whole narrative of building scale, what are the marketing non-negotiables? If we have to ask you, what would you never compromise and keeping growth under pressure? Because at the end of the day, you have to balance between growth ambitions and also regulatory compliances. So I think it's all comes under one piece when you're building this narrative.
So I don't know from a marketing perspective, but overall, what we would never compromise on is differential pricing or some sort of a, which I've seen some others do, right? In Gurgaon, it's a certain price. In Bangalore, it's a certain price. So we would not do that, unless there is actually we would definitely never do that, right? Even if there are real, like, actually we're getting it cheaper in Gurgaon, and
so one price, one nation.
One price, one nation. I think that's very, very important, especially for the same service, same product. Beyond that, I think from a regulation perspective, I think there's still, like, India needs to develop some of these regulations around health tech.
Yeah.
Health tech overall is not, we're still governed by the 1945 Drug and Cosmetic Act. So that needs to evolve. I don't think we're doing anything wrong from a marketing perspective. We are not marketing and saying, and this is a gray area, which is now we are seeing this, right? A lot of people are marketing, almost pseudo marketing a drug. And I'm not going to name the guys, but you can see it. But we will not market a drug. We will not say that you take this and you will lose weight.
Got it. Because what happens is, in a market like India, they wait for the patent to expire in the West, and once that patent expires, then everybody comes in, replicates the drug, and then creates their own marketing strategies and pushes the drug out.
That's the pharma marketing strategy, right? And they wait to actually push it back to the US or wherever else, right?
Okay.
Right. And the pharma marketing is very different.
Yes.
Which is,
But that becomes part of your inventory.
So that becomes part of our
because
inventory.
Let's say a cancer drug suddenly loses its patent or it expires its patent, then it's accessible to more.
And
suddenly your inventory sees a rise.
We that becomes part of our basket, and we've seen that, right? We've seen before there was a patented medication which used to cost the Indian patient about 76 to 80,000 rupees per month, and that's when the patent expired. That has now come to 7,000 rupees. That's the huge difference, right? So I think it's a good thing, right, that this is happening. But what it would not we are not going to govern pharmaceutical companies, right? What we need to do is, we're very, very clear that whatever is being prescribed, we need to make sure it's available to the patient, right? So we're not going to interfere where we cannot, and I think the government and pharma companies are now slowly doing a good job in regulating their own practices, and we are just enabling them in being that more transparent.
Because the pharma companies will also look at you as one of the distribution funnels.
Yeah, if you see everyone, and sometimes this is a little bit of a buzzword, right? Patient first. But everyone wants to be patient first. Government, pharma companies, doctors, everyone, hospitals, everyone is saying we are patient first, right? And we are also saying that. So that in that way we're not disaligned in any way. Everyone's patient first.
One price, one nation, one slogan.
One slogan also is, and if everyone practices that, which is patient first, and not provider first, because that's the other one, right? Which is who are you keeping in the center? Are you keeping the doctor in the center, or are you keeping the patient in the center?
Understood. I think that helps us get to a place where how do you measure success and what is the long-term impact one is making. So how would you today evaluate your marketing strategy, and what is the ideal outcome that you would want when you're engaging with the patient? Obviously, trust and adherence go hand in hand, but is it only conversion right now, or what is the ideal success metric?
No, I think the biggest one, which is the reorders, right? So over 75% of our revenue comes from existing
Repeat
customers, right? And that's how we're able to grow.
Yes.
Can it be better? I think so. We can further improve, but I think that's a combination of getting people, improving awareness.
Right.
That's the biggest key, right?
Yes.
Because if we improve awareness, people discover us earlier in their therapy journey and not later, right? And when either the journey is ending, which the therapy is just ending, or they sort of the therapy switches. So the important thing is to raise awareness, and I think that's what we focused on, because the other metrics are fairly good. Our CAC is really good actually, compared to our LTV to CAC ratios are in the 7 to 8, which is and plus increasing. So that those things are from a marketing perspective, LTV to CAC is really good. All we need to do is just acquire more at a faster rate, and for that is where we're hoping to accelerate.
Sure, got it. So what signals tell you that the patient's genuinely relying on you or MrMed as the right healthcare partner? What are the signals they give you? There must be some conversations or some behavioral change you must have noticed that 2 years back this is how the patient engaged with me, and now it's he or she's engaging, or the caregivers engaging with me in a different way, and this is what is the common thread that binds us.
Okay, so lots of signals, and sometimes when we have a tech glitch, we go back right to the earlier days, but which we don't have too much, to be honest. But the biggest one is repeat rate, right? Reorder. Like, people are directly reordering. There is no, hey, I'm going to get to 95% of the journey and then I'm going to wait and see what happens. Right? Before it used to be that, right? I'm going to wait. I'm going to WhatsApp. We have a WhatsApp number as well to generally help people who don't know how to, use technology and all of that. But what we're seeing is our reorder rate directly. Direct. So no agent assisted. So the agent, basically what we call it, there's agent assisted revenue and there's and the other one, right, which is not assisted by agents, and that is increasing, and the percentages are also increasing. That means people are saying hey, listen, we don't need to now call you as much. We don't need to message you. We know that you're going to do what you've promised. We know you're going to get that. And I think that's a combination of some of the tech we've built along with the operations that we're expanding. We've expanded beyond now. Yeah.
So and what is the metric that you feel that you want to deprioritize, because at the end of the day you want to also build a long-term brand? So anything that you feel that this is something I definitely don't want to do?
So Saurabh will kill me for this, but sometimes I think of gross margin can be deprioritized, because this is such a fluid market in supply demand. Prices, especially on the demand, on our procurement prices they are to some extent very up and down. But we said, we want to keep one price.
Yes.
And that can be a little, so how do you get that right price? So I always fight for, let's just keep it at the lowest price. And so I was no, let's try to search for the optimum, and I'm you never find optimum.
Understood. A lot of these e-commerce brands end up converting into physical stores also. Is there some kind of a plan wherein you see MrMed shops being available in those hinterlands which were inaccessible or dark areas?
So I don't know if it's going to be MrMed shops, and I don't know if it's in the hinterlands, but definitely MrMed is, we have a physical presence. We are inventory led.
Correct.
Right? So we do have physical, if not, you want to call it dark stores. Or, I mean, the one in Bangalore actually is pretty nice. You can go and check it out. We welcome people to come and inspect it also.
Right.
So you can say you can come and purchase from Bangalore as well. But we definitely see us being having a Phygital model.
Right.
Whether it is pharmacy and only, but I think it's going to be a combination of pharmacy plus services.
Right.
And we would expand to all 24 states. Whether we're going to go into every district of every state, I don't think so.
Okay. Fair enough. Now, when you look back today, when you look back at your journey, what is that one decision that you feel was more strategic or marketing led that best reflects the commitment that MrMed has towards a patient-first, trust-driven healthcare brand?
One decision, no?
Or maybe couple of approaches that you all made that is reaping you good dividends.
So I told you, right? Like complete transparency.
Okay.
On pricing, on not changing. We don't have this Wednesday sale, right?
Okay.
I think we tried like a little bit like, okay, we'll give you a cashback. It was New Year's or something like that. But we don't do when this Wednesday, this Thursday, Bonanza, Republic Day sale.
So it's less transactional.
We don't do that because like we've kept it intentionally like that. And sometimes this doesn't help us, like the marketing guys will be like, hey, you should do a sale.
Yes. Black Friday sale.
I mean, I don't. So for us, it's always
but your community, your audience is
different. And for us, it's because we've always kept it at low prices. The other thing is, which people do like hate us for sometimes, is we do charge payment gateway fees, like how IRCTC does it. And the only reason is because we've kept the prices so low that we like there is a way in which you can avoid payment gateway charges, which is by using these instruments, right? Which is UPI or debit card. You don't really pay any payment gateway charges.
Devashish, I just want to ask you one question when it comes to marketing evolution in 2026. Do you think that it's going to continue to evolve, or we've reached a stage wherein it will be business as usual when it comes to specialty pharmaceuticals?
So specialty pharma in general is on the rise. And it's not just about cancer, oncology, or weight loss, obesity that we spoke about. It's about even ophthalmology, for example, right? So all super specialty conditions, or all specialties are it's just the pharmaceutical companies themselves are focusing on creating newer age therapies, also newer ways of delivering existing therapies.
Right.
So for example, the most widely prescribed blockbuster anti-cancer drug in the world is now becoming a subcutaneous injection. Earlier it was an infusion. Right. So you needed to go to a daycare center or a hospital. So what's happening is overall, like more and more therapies are being developed, right, for conditions that earlier either required a surgery. Now you can probably use a medicine. And then the second thing that's happening is for existing conditions or existing therapies is the drug delivery mechanism is moving towards a more at-home, which can be done in an at-home setting, whether it is subcutaneous or tablets. So what we're seeing is that this is going to be on the rise. So healthcare, specialty healthcare is moving more towards an at-home outpatient setting, which is where it makes it very exciting for us. And even for the pharmaceutical companies, economics also change.
Yes.
Because when you're moving from delivering something at a hospital to at a home, so then you need specialized players to make sure that it gets delivered at home.
Yeah. We've reached the end of the conversation, and I have one last question. What advice would you give marketers today who are transitioning from FMCG or tech into pharma? Or
don't play discount game.
Okay.
I think that's the biggest one. Of course, India is a price sensitive market, and it's important to give the true price. but don't play these price games, right? It might work in FMCG, but it shouldn't. It will not work in pharma, right? At least to the patient, it will definitely not work. Yeah, and I think I think trust is everything, right? Everyone says trust. Every product you can have trust, right? But I think in this space, it's life or death, right? So you better make sure that when you say trust, people can actually it's all throughout the organization and not just a marketing slogan.
So this would apply to even any student who is graduating and stepping into the pharma industry. Would this apply there also, or you would want?
Of course, the pharma industry again is huge. Like there's pharmacy, there's pharmaceutical industry. Within pharmaceuticals, there's so much, right? But yeah, I think whatever you're doing, we should not. And I think thankfully the government is also doing a great job in no cutting corners. Trust is like sacrosanct. It's sacrosanct, right? Like doctors take a pledge, I think pharmacists also take a pledge.
Great. So clearly health is wealth, and that's the way forward.
Yeah, I mean, that's how it is.
That's lovely. It was a very insightful conversation. Thank you, Devashish, for sharing a grounded and insightful perspective on building a healthcare retail brand. Your views reinforce that in essential categories, long-term trust is built through consistency, service quality, and everyday reliability, not just campaigns. Thank you for watching the HT Brand Leadership Series. We look forward to bringing you more conversations with leaders shaping India's brand landscape.
Thank you so much. Thanks for having me.
Thank you so much for your time.
Thank you so much.